Hi, my name is Lily, and we are here to do the liver cancer presentation.
Hi, I'm Giselle.
Hi, I'm Taya.
Hi, I'm Roxana.
So, what is liver cancer? Liver cancer is a malignant disease in which abnormal cells in the liver grow uncontrollably and form a tumor. It is the sixth most common cancer worldwide and is the third leading cause of cancer-related deaths. As we know, the liver is responsible for many vital functions that keep the body in balance. It filters toxins and waste from the body, produces bile to help digest fats, stores and release glucose for energy, and synthesizes proteins such as albumin and clotting factors. Because of its central role in metabolism and detoxification, damage from the liver from liver cancer can disrupt numerous body systems. There are many types of liver cancer. The most common ones are the hepatocellular carcinoma. It's the most common type of liver cancer in adults. It usually develops as a single tumor within the liver and is often linked to chronic liver diseases such as hepatitis B, hepatitis C, or cirrhosis. We then have the cholangiocarcinoma, which is a slow-growing cancer that begins in the lining of the bile ducts, either inside or outside the liver, and it often causes bile flow obstruction, leading to jaundice, itching, or abdominal discomfort. Next, we have angiosarcoma, which develops in the blood vessels or connective tissues of the liver. It progresses rapidly and is often associated with exposure to toxins such as vinyl chloride or arsenic. We then have hepatoblastoma, which is a pediatric liver cancer that usually affects infants and children under 2 years old. It typically presents as a palpable mass in the abdomen and has relatively good prognosis when detected early and treated promptly. And lastly, we have the fibromegalar carcinoma, which is a rare form of liver cancer that typically occurs in young adults, more often in women who have no history of liver disease. It sometimes is mistaken for a benign liver tumor due to its slow growth, but can still spread to other organs.
Hey, and then here's a look at the main causes and risk factors of liver cancer. At the top, we have liver cirrhosis, which is the main contributing factor to liver cancer. Cirrhosis happens when healthy liver tissue is replaced by scar tissue due to injury, and the scar tissue blocks the blood flow and it makes it harder for the liver to do its job. So the liver is going to try to repair itself, and cells divide more often. And because they divide more often, they're more prone to causing mutations. And then over time, these mutations will cause cells to grow uncontrollably, leading to cancer. So some of the conditions listed under cirrhosis also contribute to scarring, and they cause long-term damage like chronic hepatitis B or C infections. These are viral infections that attack the liver cells directly. People who drink alcohol are also at increased risk because alcohol damages liver cells as well. People with non-alcoholic fatty liver disease, that's when excessive fats build up in the liver, causing inflammation and scarring. And patients with obesity or diabetes are at increased risk for non-alcoholic fatty liver disease. In hemochromatosis, it's when the body stores too much iron, and the iron goes to the organs, and in this case, the liver, and it will just cause scarring and increase the cancer risk as well. Then we have other causes and risk factors that also play a role in liver cancer, such as aflatoxins. They are toxins that are produced by molds, which develop on grains or nuts. And they can directly damage liver cells as well. And cigarette smoking, the tobacco in cigarettes are carcinogens, so they can cause liver cancer. And so some general signs and symptoms patients will present with, they will say that they're extremely tired. And this is just due to the liver not working properly. So they're just going to naturally have less energy. They're going to have changes in appetite. They're going to have weight loss because of their metabolism changes. They could have mild fever. due to the inflammation from the tumors or secondary infections. And a lot of patients with liver cancer say that they feel sick to their stomach. And this is because the liver can't process toxins well, so they're going to be very nauseous and they may vomit. The structural symptoms are due to the tumors that develop in liver cancer. So they'll have right upper quadrant pain due to the tumor swelling and pressing on surrounding tissues. They may have a palpable mass due to the tumor growing, and they will have fluid built up in their abdomen and their lower extremities due to the liver's inability to produce enough albumin. They'll have swollen visible veins due to the blood flow being blocked, specifically in the portal vein. So it's just going to increase that pressure and the veins are going to become visible. Some signs and symptoms that are more specific to the liver and metabolic dysfunction is jaundice due to the bilirubin building up in the bloodstream, and they'll have pale stool because the bowel is not able to reach the intestines to be excreted through the stool. And their urine will be dark, like a tea color dark, because the bilirubin is going to go into the urine. They may experience itching because of that buildup of bilirubin in the blood and the bowel salts in there. They could have increased risk for bleeding because the liver is unable to make clotting factors. Now we have some diagnostics that are used to help diagnose liver cancer. So doctors can order a CBC, and with that, you would see a decreased hemoglobin due to the liver's inability to support blood production, as well as low platelets because it's not able to produce thrombopoietin. They will also order liver function tests, and so you're going to see an increase in the ALT, the AST, ALP, and bilirubin due to the liver injury. Also, like I mentioned earlier, they're going to have low albumin, and their PT and INR will be prolonged because they don't have those clotting factors. The alpha-fetoprotein is a protein that is produced by liver tumors. So you will see high levels of this, especially if it's over 400 nanograms per milliliter. That's going to suggest liver cancer. Providers may order imaging studies such as an ultrasound just to see if there's lumps or any abnormal areas in the liver. They can order a CT or MRI to get a more detailed picture of the liver to check for the tumor size to see if it's spread anywhere. They can order a PET scan to show where the cancer is active. They can even order an angiogram just to see how blood is flowing to the liver and to the tumor. So while all of these diagnostics are implemented to see what is going on with the patient, the procedure that is definitive for this diagnosis is a liver biopsy. It's the only way to really be certain that cancer is present in the liver. And so they'll take a small tissue sample and they'll check for cancer cells under a microscope.
Perfect. And then for treatment options, it's just going to depend on the stage of the liver cancer, the age of the patient, and their overall health. We have the most invasive treatment option, which is surgery. We have liver resection, which basically just removes the liver cancer if the tumor is small enough and if the liver function is still good. But it just depends on where the cancer is located and how good the liver is still functioning. And if they're not able to do a liver resection, then they would take into consideration liver transplant surgery, which is basically where they take the affected liver and they replace it with the healthy one. But in order to have this, you would need to have the other treatment would not have to been taking place, and then it would not have been able to spread beyond the liver. And usually the diagnosis requirement is that they have a single tumor that is either greater than or equal to 5 centimeters, or if the patient has 3 single tumors that are equal to or greater than 3 centimeters. And then for localized treatments, these treatments are administered directly to the cancer cells. So for the first one, it's the radiofrequency ablation. which is basically just heating up the cancer cells. There's a small incision made to the abdomen, and the needle will use electric currents to heat and destroy the cancer cells. And then for cryoablation, it is freezing up the cancer cells. And there's like a little picture there. There's a probe that contains nitrogen, and it's directly placed on the tumor. And they use ultrasound images to help so that they're able to freeze that. The other options are injecting alcohol directly to the tumor, which causes the cells to die. There's also one placing beads filled with radiation, and they're just tiny spheres that contain radiation, and they're also placed directly on the tumor as well. And then other treatment options are the targeted drug therapy, and this is just to block the abnormalities that present within cancer cells, which are able to kill the cancer cells as well. And then immunotherapy, it's usually for advanced liver disease, and it's usually in combination with either chemotherapy, radiation, or even surgery. It just uses your immune system to fight cancer cells because cancer cells produce proteins that bind to your immune system cells. So it interferes with that process. And then chemotherapy is administered IV, and it rapidly kills cells that are rapidly growing. And then radiation, there's two different types. There's the external beam radiation, which you lie on a table and the machine directs energy beams at a precise area on the body, or the stereotactic body radiotherapy. There's a lot of beams all focusing on one area all at once. And in order for prevention and lifestyle changes, you can have screening done if you have risk factors that like alcohol use or things like that present like multiple risk factors. You can get regular screening like every 6 months, and that would be the ultrasound, looking at the blood tests, and the most invasive would be a biopsy. But as far as lifestyle changes, regular exercise, controlling your weight since obesity is a big risk factor, eating a healthy diet, which can include drinking milk and eating yogurt helps fight it, and just foods that have like whole grains, fish, and veggies because they have omega-3s and healthy fats. You also really want to find foods that are rich in fiber and antioxidants. And also it's important to avoid processed meats, sugary beverages, and saturated fats. And then you can also have alcohol and smoking cessation. Lastly, other preventions kind of target the risk factors. So it would be Hep B and C prevention, which you can get that Hep B vaccine. And if you do have chronic Hep B, it's recommended to have antiviral therapy just because it reduces the risk a lot. And just for Hep C and B, just using condoms, no sharing needles, just avoiding that blood pathogen. And other preventions would just be maintaining blood sugar levels of diabetic and considering medication therapy if there's abnormal cholesterol levels.
So for current research and future directions, so under screening and surveillance, current research includes testing the use of a radioactive substance, which is known as a radiotracer that may help doctors see specific parts of the body in order to detect small and early stage liver tumors that can be difficult to be detected on a regular ultrasound exam. This will be extremely beneficial in detecting HCC or hepatocellular carcinoma for patients who have obesity or cirrhosis. Also, scientists are currently working on finding biomarkers such as DCP and lectin AFP in blood, urine, or other body fluids that can help identify early stage liver cancer in patients who have cirrhosis. Now, for targeted therapy for HCC, so current research has led to the discovery of several new targeted therapies, one of them being lenvatinib or Lenama. So this medication helps treat HCC in patients whose cancer cannot be removed by surgery. How this medication works is that it helps block proteins that signal cancer cells to divide. It also blocks proteins that signal the growth of new tumors. And now for targeted therapy for bile duct cancer, new targeted therapies for people with bile duct cancer who have specific gene changes in their cancer cells. So this medication is called olaparib or Lynparza. And how this medication works is that it helps to stop the growth of tumor cells by blocking some of the enzymes that are needed for growth. For immunotherapy, there's CAR T cell therapy, which is currently being tested for adults with advanced HCC, in which it involves removing a person's own immune cells and it modifies them in a lab so they can better be recognized and attack this type of liver cancer. For bile duct cancer, current research is including combining two different types of drugs, either an immunotherapy drug like Keytruda or a chemo drug like Capox to help shrink or stop the growth of tumors. And there's actually very good results. About 80% of patients have reported improvement when combining these two types of medications. Next slide, please. So in conclusion, we talked about the different types of liver cancer today, like angiosarcoma, bile duct cancer, fibrolamellar carcinoma, hepatocellular carcinoma, and hepatoblastoma. We discussed the main causes, which are cirrhosis, Hep B and C, and alcohol abuse. There's a lot of symptoms that come with this diagnosis, such as jaundice and suffering from pale stools. A diagnosis can be reached through an abdominal ultrasound. And then, of course, if there's anything abnormal, the doctor will proceed with the liver biopsy. There will be also blood work done like liver enzymes and biomarkers. Treatment will depend on the stage of the cancer, the patient's age, and patient's overall health. But those main options will include either surgery, localized therapy, or drug therapy. And for current research and future directions, doctors are currently trying to find new ways of early detection, such as using radioactive substances and also biomarkers and developing effective treatments. But ultimately, prevention is key. So patients are highly encouraged to be up to date with their Hep B vaccines. They're also educated in practicing safe intercourse in order to prevent a Hep C transmission. And also alcohol cessation is very important. And the next slide is our references. And with this, we conclude our presentation on liver cancer. We hope everyone was able to learn more about this topic. And we want to thank everybody for watching.
Thank you.
Thank you.
Thanks.